Hi, I'm Hope Spano from the Minneapolis Area Chamber of Commerce, and today I have with me from All Smiles Dental Care, Dr. Ashley Swisher and Dr. Jill Ahlers. So thank you ladies so much for being with us today.
Thank you.
All right, so we just want to talk a little bit to our listeners about your guys' story here at All Smiles, how long we've had the business here, and you know, I know Ashley's been here from the beginning, and Dr. Ahlers that you have joined later on. So I would like, Ashley, for you to just, first of all, tell us how long ago All Smiles Dental Care got started and kind of what brought you to the area.
I actually graduated dental school in 2009 and worked with another practice for a year, and it was a larger practice. I figured my dream was kind of to own my own practice, but maybe not quite a year out of school. The opportunity in Ottawa County presented itself, and it seemed to be a perfect fit. I'm from Jewell County, and my husband's from Lindsborg, so Minneapolis is right in the middle. It's a great community, really strong. At the time, the pharmacy was kind of just growing, and changes were being made to the hospital, and I could see that it was a community that really invests themselves in healthcare. And I wanted to be a part of that. And the school systems are amazing, and just so much going for it that I couldn't say no. So
life has a way of doing that sometimes.
Yeah, has a way of doing it. So that I came up here just a year out of school, and it's been 7 years now in June. And so we've had a lot of changes, and of course the new building came shortly after that. And I think that we just all together, I wanted to be able to present kind of the state-of-the-art dental experience, even though we're in a small town. But also not take away from the personal and patient relationships, which is #1 in my priority. I think you can present ideal dentistry, but unless you help figure out what's best for the patient, that may not actually be ideal dentistry. So kind of just getting to know them and getting to know what's best for them is helping them find a great solution is what I am passionate about. So.
And you guys have definitely done a good job at finding that balance there. And I know that it is something that's important in a small town for people to have that closer knit relationship. So it's good that you guys value that, but also to do things over and above and to do something great here, even though it is a small town.
Sure.
So I definitely appreciate that.
Thank you.
Okay, so you've been here 7 years. I know a lot has changed in that time. And Dr. Ahlers, I would love for you to just kind of introduce yourself and tell us your story about when you came on and what you feel like you've added to the team.
So I joined All Smiles last June, so it's almost been a year.
Can't believe it's been a year already. That's crazy.
I grew up just north of Salina, so I'm from the area here too. My husband is from Bennington. I went to Sacred Heart High School in Salina, and then went off to college and dental school. My family's still around the area, so that was obviously a big reason to come back. So I graduated 10 years ago from dental school. I did a residency for a year in Kansas City, so I did some additional training in dentistry, kind of in all fields of general dentistry. I kind of specialize in surgery, which I really enjoy, so oral surgery. And so my husband and I started a family, and we were living in Montana, which is quite far from my parents. So we kind of talked about moving back to Kansas, and this opportunity came up for me, and it was a great fit because we were close to family. It's a great practice. It was exactly what I was looking for as far as technology, small town feel, everything that I could do to be a better dentist myself. So I'm really happy to be back in the area, and it's been great to be close to my parents and family, and it's great for our kids. So we're
get that small town life again. Okay, very cool. I can't believe it's been a year already. That's just crazy. And you were talking about doing the surgery, doing the dental surgery and stuff, and that's something that you guys have added just in the last couple of years, and then we're able to expand upon it when Dr. Ahlers got here.
We actually had it before, but in a little different sense of Dr. Ahlers had more experience in more complicated cases. And since we already offer sedation and we do IV sedation and bring in a nurse anesthetist, it kind of fits now that she's doing more wisdom teeth extractions.
Okay.
And things that generally you would want to be put in IV sedation for anyways. So it just fit to be doing more of that, and her doing more of that frees up more of my time to do some of the other.
Yeah.
Which is like when we added doing braces, it's been almost 4 years now.
Oh, really? It's been almost 4 years you've been doing orthodontics?
It's been a
Oh my
huge,
God.
yeah. So we offer orthodontics. We still work with the specialists in orthodontics on our difficult cases. Same with oral surgery. Of course, if something if we don't feel comfortable doing it, then we are definitely going to refer to the specialists and talk to them. And we actually do a lot of study groups and things like that with several in the area, and then even with several nationwide and international wide sometimes. And so that is a good mentoring group for us, because we do feel like we probably won't ever know all the answers. And so we want to be willing to admit that and get the right ones and get on the right track when we aren't. But we did see a huge need for orthodontics in the area. The amount of time and money it takes for people to take out of school and go get kids and run them to and from. And I had done some in dental school and loved it. I just didn't have really the time to do it in my first couple years. So now I'm able to get a little bit more hands-on and do more of that. So, yeah, it's been great having her back.
Yeah. Well, and I understand you owned your previous practice that you were in, correct?
I was a partner.
Okay.
Yeah.
Yes.
Okay.
I was a partner in my previous practice, so
Okay.
kind of came with some business
Side of it.
experience. And
Yeah, that was really a great addition, because I know Ashley was solely owning the business before, and two heads are better than one, and so just to see fresh ideas from somewhere else, and and like you said, getting new ideas and fresh ideas. And the medical field is so quickly changing all the time, so
Right.
I love that you guys are just always thinking forward and trying to branch out and improve upon what you can do here. Okay, so what are some other specialty services that people might not know that you guys provide? I would love to just get as much information as we can out there. I mean, they see All Smiles dental care, and they know that there's a dentist here, but what's some information that people might not know about what you guys do?
As Dr. Swisher said, we do sedation, which is, I think, a really good option. Different sorts of sedation as far as laughing gas, IV sedation, different levels of oral sedation. Of course, you mentioned that I do quite a few wisdom teeth cases, so that's something, a lot of teenagers go through needing wisdom teeth removed, and so we can offer that to most patients.
Okay.
And then we do work on children a lot, so sometimes people don't realize that, and I think that's a great service for the community.
Yeah. There isn't really one. We have to be careful in the medical field about the word specialty. We're general dentists, and so we're doing all of the specialists, and we're held to the standard of the specialist. And so there isn't one realm that we don't do here. So we do dentures, we do implants, we do the oral surgery, we do pedo. There's really very minimal specialties in dentistry, and we do have more and more resources all the time, especially close in Salina now. But before, they were having to travel quite a ways, and pediatrics is one of them that they had to travel quite a ways for. We do feel like we bend over backwards for our kiddos, because that's what we would want done for our kids. There's a huge need for that in just the medical field in general. But it's also with adults and anxiety. It's the little things of giving them the options, what makes them feel comfortable. We try to tailor it as much as they will communicate with us about how they would like it tailored. And we really pride our practice. Sometimes we say we push a little too much with our team, but in making sure that we're notating and trying to remember what every patient wants. And so that's unlike most general practices. You kind of ask, like, why us? And it's a little cheesy thing our team came up with a while ago, but it was like about journeying beyond the smile, because it's not just about teeth, it's about the person. And that little bit can go a long way. So,
absolutely.
We're not saying that we're changing lives, but we're kind of just trying to change the outlook on dentistry. And of course, you know, we try to go overboard every day with that, and some days are easier than others, or some patients easier than others with. But ultimately, that's kind of what we would want done for ourselves. So.
And you're making that effort, you know,
Thank
you said, some days are harder than others,
Yeah.
but if you don't make the effort's not there, you know.
Yeah.
So it's appreciated that you guys are making that effort every day, whether it's an easy day or a hard day.
Yeah.
And as a patient and a parent, you know, I appreciate that too. I mean, like you said, that we didn't really have it in the area before. I mean, before you guys were here, I drove my kiddos to Manhattan for their first kids' dentist appointment, because that was the closest place in the area that really was recommended for with children, you know. And so I feel like you guys have really picked up that specialty here, and because you're the only dental practice in Ottawa County, correct?
Yes. Yep.
And so the whole area really benefits from you guys.
And we appreciate that, because it's funny, we were saying with our girls, kids are at that age when they go out to sporting events, they start being like, Mom, how do you know that kid? How do you know, you know?
Oh, yeah,
and it's
from
really
around the
fun
area.
to be able to support other kids. Of course, Minneapolis, Bennington, and Tuscaloosa first. But to be able to see those connections, and a lot of people who have relatives from this area and that sort of thing. So I like to think of it as giving back. And what's really cool is, too, there's so many more people who will come to the dentist than there will to a physician. And so we really pride ourselves in pushing the general health, and like making sure that we're the patient's advocate, and to get them on board, and just encourage, not lecture. Because there's a difference. Although some of you feel like we lecture. But the big thing behind that is, what can we do to help them live healthier lives, live longer lives, all that kind of stuff. And so it's really fun when we see that connection happen, and we have people who hadn't gone to physicians for 20 years, and now they're going to a physician, and they're like, I never knew this, you know. But yet they had family history of heart attacks or strokes, or they had, you know, family history of having dentures young, and those are the kinds of things we can make a difference on, and that we're seeing a difference, and especially because we do have such a good health community here. So it's nice to be able to plug them back into other areas, and
we're all in this together. We might as well help each other out and work together. So that's great. Okay, so just little logistics things, like, what are your guys' office hours, your regular office hours?
Our regular office hours are, we see patients from 7 to 3:30, Monday, Tuesday, Thursday, Friday. Some days we are open on Wednesdays. It depends on changes in the schedule, or we'll typically do a sedation day on Wednesdays. So.
And I know you guys are really good about posting that on your Facebook page. I've noticed that a lot. And so, you know, I think that would be a good outlet for people to connect with, if they want to make sure when your office hours are being held that week, if there's a change in the schedule or whatever, they can usually find it there. And then you do have a website too. And what's the web address for that, if people want to look up your information there?
I believe it's All Smiles Dental Care
Kansas.org.
Okay. All Smiles Dental Care Kansas.org.
We are soon changing that. And
it's going to change.
A little bit easier, of a domain to get it. So hopefully we'll launch our new one June 1st. And so it'll all be different. So it'll be easier to be able to schedule and things like that.
Well, I will make sure and get those changes on the chamber website. So after June, people can make sure and look there, and they can reconnect to the new address that way. But I'm sure you guys will post it on your Facebook page as well. Those changes, so people can reconnect with you that way. Well, is there anything that I maybe didn't ask you guys that you want to get out there? I mean, you've already given some really reasons why you guys are worth the drive here. So I'm glad we're getting that out there. So what have I missed?
Be sure, we really love to be connected with the community. So anytime there's anything that we can give back to, or you need help with, especially when it involves general health, but especially oral health, we really want to get more on board with, you know, being able to screen the community. And we're doing some oral health cancer screenings in June, like with Tammy Walker Center and things like that, that it will be a little bit of a bigger on a bigger scope. But if there's anything like that locally, we'd love to come into schools and talk and do what we can to make sure we keep our population around here really educated and on track with things.
So you would just encourage anyone who would have information about that
Absolutely.
to contact you guys and kind of
if you ever need anything,
Okay.
don't be afraid to ask.
Okay.
So, all right.
Well, thank you,
very
Dr.
much.
Ahlers, and thank you, Dr. Swisher, for being with us today. I think that's it from Minneapolis. Join us next time.